When you realize we're talking about sterilizing children with this combination of puberty blockers and cross-sex hormones, this is eugenics. It's as if the medical, psychological, pharmaceutical complex, right, is targeting emotionally troubled youth, is evil.
The best of the week on Relevant Radio.
What are the irreversible harms of puberty blockers, cross-sex hormones, and cross-sex surgeries, if any? Well, there's a lot that we know and much we don't. Dr. Michelle Cretella is joining me today. She's a distinguished pediatrician and researcher. And in her research, she isn't just publishing research on this topic, but peer reviewing other research of physicians, secular physicians across the world who are studying this exact topic. What is the medical impact to children, to adolescents, to people prior to puberty, after puberty? So without further ado, Dr. Michelle Cretella, thank you for joining me. I would like to hear your take on the damage that is rarely discussed when it comes to everything from outright stopping and blocking puberty to the hormones that are given and the so-called therapeutic treatments for surgery today.
First, so important to realize puberty is not a disease. Puberty is a critical developmental period, not just for secondary sex characteristics like, muscle development, voice development, breast development in girls, and ovaries in girls, and the testicles and sperm in boys. So not just secondary sex characteristics and reproductive function, but the organization of the brain tissue, as well as bone development and psychosocial and emotional development. So when we put a biologically normal, physically healthy child at age 8 on puberty blockers, we're stopping that critical normal period of development. And if that 8-year-old is on that blocker for the next 2 months, 2 years, 5 years, we have just robbed them of that amount of time of normal development. Without a time machine, we can't give them back that 2 months, 2 years, 5 years of normal interaction with their peers, normal growth, etc. It's harm. It's objective harm. You're causing a disease when you stop normal puberty. What does the research show in terms of physiology? We know that the children on the puberty blockers, when they go on the puberty blockers for gender dysphoria, even when they are put on the opposite sex hormone and they get to young adulthood, they have weak bones, low bone density, and it cannot be repaired. This means that as adults, they can expect to experience osteoporosis and bone fractures at young ages. We have good reason to suspect that with the puberty blockers, as I said, once you block that puberty, you are preventing the normal brain organization and wiring. When we use the puberty blocker Lupron, it is FDA approved to treat prostate cancer in men. While those men with prostate cancer are on the Lupron, they experience memory loss. Women may be prescribed Lupron for some gynecologic conditions. It's FDA approved. Those women will experience memory loss from the Lupron, which is the number one puberty blocker. So what are we doing to these physically healthy children when we put them on this puberty blocker that causes memory loss in adults? We know that we're altering the brain wiring, but we haven't had a long enough period of time or study to determine exactly how we are altering this and harming them. So that's pretty scary. Puberty blockers, because they stop the maturation of the ovaries in girls, they stop the maturation of the testicles in boys, they cause infertility. If you give children the puberty blocker early in puberty and then put them on cross-sex hormones, you will permanently sterilize the child. So, when you realize we're talking about sterilizing children with this combination of puberty blockers and cross-sex hormones, this is eugenics, because it's as if the medical, psychological, pharmaceutical complex, right, is targeting emotionally troubled youth, saying, oh, you're trapped in the wrong body. And the solution to your unhappiness is we're going to sterilize you and then recommend you for mutilating surgeries. So I've started saying, even to doctor audiences, when I'm before the doctors, they say, you know, what we are doing right now is evil. We cannot stay silent, because these are emotionally vulnerable children who are being sterilized.
It's heartbreaking. It's eugenics, it's population control, and yet all in the name of therapeutic treatment, as if someone's going to the spa when their very identity is what they're struggling with. I mean, how little compassion can we have as a society today to say, you know what, your identity's struggling, let's just offer you these life-damaging drugs. Dr. Michelle Cretella is here with me today on Trending. Dr. Cretella, the conversation is cut so short. We're going to have you back soon. Please check out her work. Biologicalintegrity.org is a great resource for addressing this from a medical perspective, setting the truth correctly in the hearts and minds of people when it comes to solutions for children and adults struggling with their identity. Like what you just heard? Share it with your family and friends. And thanks for listening.